Hello, this is Dr. David Green, CEO of the TEX-PAIN Network. Today's topic is radiofrequency ablation for back and neck pain treatment. Back pain affects 90% of individuals at some point in time, and for neck pain it affects about 10% of the population at any one point in time, up to 45% each year. Back pain is the second most common reason people see a doctor, just behind the common cold. It's the leading cause of disability in those under the age of 45. It's seen in up to 40% of those who undergo back surgery. With neck pain, 50 to 70% of individuals have neck or shoulder pain at least once in their lives. For the cervical and lumbar facet joints, these are about the size of a thumbnail. They're bilateral. They do have cartilage just like the hip or the knee. They provide motion for the spine. However, they are prone to arthritis, just like those other joints. They are the cause of back or neck pain 45% of the time. Unfortunately, we don't have a successful joint replacement for the facet joint like we do for the hip or the knee. So when you start to make the diagnosis, it's a combination of history, physical exam, x-rays, CAT scan, and maybe some diagnostic injections. Here's a facet on CAT scan. You see the joint here and the joint here. These look great. Okay, there's no rattiness, joint space is well defined, whereas on here, it's hard to define even where the joint is. You got a lot of bony overgrowth, a lot of facet arthritis. So it can end up being a coin toss as to where the pain is coming from, because you may have severe pain with very little arthritis, no pain with horrific arthritis. Even the best trained spine doctors are wrong half of the time. But diagnostic injections can help a lot. Medial branch blocks around these joints can provide pain relief and tell the pain doctor, aha, that joint is causing the pain. The same type of information can come from a facet injection where the needle actually goes into the joint and provides pain relief. Now, if those injections work well, provide pain relief and then wear off, then a person can go on to have a radiofrequency ablation. Well, what's a positive result for a diagnostic injections? Some say 50%, some say 80%. Some insurance companies require 80% pain relief on 2 separate injections before approving the radiofrequency procedure. The medial branch block in and of itself can provide 3 months of pain relief on average. It serves as both a diagnostic and therapeutic procedure, and when it wears off, it can be repeated or the person can move on to a radiofrequency ablation. Some people call the ablation a radiofrequency neurotomy, medial branch neurotomy, medial branch denervation, radiofrequency denervation. All of these mean the exact same thing. 5 facts about radiofrequency. The current used during the procedure is actually the same wavelength as radio signals, but there is no FM radio involved in the procedure. It can be more painful afterwards initially. Pain relief may last for upwards of 2 years with the procedure. As mentioned, you do need to have the diagnostic injection before, and it truly has been a revolutionary treatment for back and neck pain, a lot because of the length of duration of pain relief.